Quality in assessment. In general, high quality assessments are considered those with a high level of reliability and validity. Approaches to reliability and validity vary, however. Reliability. Reliability relates to the consistency of an assessment. A reliable assessment is one that consistently achieves the same results with the same or similar cohort of students. Various factors affect reliability, including ambiguous questions, too many options within a question paper, vague marking instructions, and poorly trained markers. Traditionally, the reliability of an assessment is based on the following. Temporal stability. Performance on a test is comparable on two or more separate occasions. Form equivalence. Performance among examinees is equivalent on different forms of a test based on the same content. Internal consistency. Responses on a test are consistent across questions. For example, in a survey that asks respondents to rate attitudes towards technology, consistency would be expected in responses to the following questions. I feel very negative about computers in general. I enjoy using computers. These are two sentences. The reliability of a measurement X can also be defined quantitatively as where is reliability in the observed test or score X, and are the validity in true, that is candidates innate performance and measured test scores respectively can range from 0 to 1, completely reliable. A reliability of 1 is rarely achieved and a value of 0.8 is generally considered reliable. Valid assessment is one that measures what it is intended to measure. For example, it would not be valid to address driving skill through a written test alone. A more valid way of assessing driving skill would be through a combination of tests that helps determine what a driver knows, such as through a written test of driving knowledge and what a driver is able to do, such as through a performance assessment of actual driving. Teachers frequently complain that some examinations do not properly assess the syllabus upon which the examination is based. They are effectively questioning the validity of the exam. Validity of an assessment is generally gauged through examinations of evidence in the following categories. Content. Does the content of the test measure stated objectives? Criterion. Do scores correlate to an outside reference? Construct. Does the assessment correspond to other significant variables? Phase. Does the item or theory make sense and is it seemingly correct to the expert reader? A good assessment has both validity and reliability, plus the other quality attributes noted above for a specific context and purpose. In practice, an assessment is rarely totally valid or totally reliable. A ruler which is marked wrongly will always give the same measurement. It is very reliable but not very valid. Asking random individuals to tell the time without looking at a clock or watch is sometimes used as an example of an assessment which is valid but not reliable. The answers will vary between individuals, but the average answer is probably close to the actual time. In many fields such as medical research, educational testing and psychology, there will often be a trade-off between reliability and validity. A history test written for high validity will have many essay and fill in the blanks questions. It will be a good measure of mastery of the subject, but difficult to score completely accurately. A history test written for high reliability will be entirely multiple choice. It is not as good at measuring knowledge of history, but can easily be scored with great precision. We may generalize from this. The more reliable our estimate is of what we purpose to measure, the less certain we are that we are actually measuring that aspect of attainment. It is well to distinguish between subject matter validity and predictive validity. The former, used widely in education, predicts the score a student would get on a similar test but with different questions. The latter, used widely in the workplace, predicts performance. Thus, a subject matter valid test of knowledge of driving rules is appropriate, while a predictively valid test would assess whether the potential driver could follow those rules.